Rodwell, you want to take a jab at it?
Again?
As flat as... Yes, hi, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So I've done what is an end block complete, 415-25 initials TC. So the excess skin, she had, relatively speaking, very large implants for the patient's chest width. End block on the right side, as you will see, complete removal. Some areas relatively inflamed, so I incorporated some of that tissue. As you can see, the capsule is very thin. This was below the muscle. And so what I'm going to do is, she had these Saline implants from 2011. So I'm going to go ahead and go in, and we will see all inflamed tissue removed and the good, healthy, viable tissue remaining behind. As you will see, look how thin this capsular tissue is. If I take this ruler and I put it in here, you can see it's like saran wrap tissue paper thin. Complete removal, leaving behind all good, healthy tissue. So as I go in, you can actually hear the capsular tissue being cut. And as I go in and I remove this, I'm very happy with how the whole dissection has gone. Blood loss was like minimal. And as you will see, you can see that stickiness. That's your leaching of that silicone. It's very slimy. And so this is your overfilled 310. So the patient had said she was in the 250 range. And so she is 310 overfilled. And you can see how there's pressure on the sides, so it's overfilled. And you can see, look at this tissue. This is the capsular tissue. Some areas relatively so thin. This is the capsule, but the tissue around has also been removed because that is part of the culprit, if you will. And so nothing out of the ordinary. I'm very happy with how the whole dissection has gone. I'm just going to leave it here. Now I'm going to remove my top sterile glove, and I have another sterile glove underneath. Remember, I'm going to get some representative samples in between the capsular tissue and the implant. And you can see overfilled. It's like kind of a balloon overfilled. This is the scar tissue that she had. If you look at the scar tissue, look. This is where this scar tissue was. So this is kind of the landmark where she had her incision right in the crease when she first got her implants. This was the tissue expanded. This was her natural crease. So this was the extra skin that I had to remove. And as you'll see, complete total capsule implant plus all inflamed tissue removal, such that she has only good, healthy, viable tissue remaining behind, and all bad inflamed tissue below the muscle removed completely, definitively. So I'm going to go ahead and go in here, and as I go in, what appears to be another saline overfilled implant from 2011. So again, you can see how thin this tissue is. So in this video, I will show, I get the cultures where my tip of the scissors is. That's the tissue that I want to get a good, there's a biofilm underneath this, right on top of the implant. And that's the tissue that I want to get a good representative sample, so I can get cherobic, anaerobic, and fungal cultures. And again, overall, I'm very pleased with how the whole surgery went. Blood loss was minimal. Anything and everything above the breast tissue was not touched at all. And not much of a stickiness, but you can see there was some at the very beginning. This is your 310 Mentor 310 cc overfilled implant capsular tissue, as you will see right here. So I'm going to get cultures from here with a swab with my sterile gloves, so I get a good representative sample, what is within, underneath the capsule and the implant. So there you have it, the end block gold standard, removing all inflamed tissue implant capsule, and doing it in an end block fashion. Relatively very large implants for the patient's chest width. The implants will be returned to the patient. Capsules to be sent to pathology, rule out the BIALC, LCD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. Cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how the patient does post-op minus her symptoms of what are strongly suggestive of what is breast implant illness. This is Dr. Khan, Executive Plastic Surgery.